Hello, my name is Peter Jones with Microsoft Canada. I'm the industry lead for healthcare. Today, many healthcare organizations are turning to business intelligence solutions to harness the data for better decision making and to help improve patient outcomes. The Better Outcomes Registry and Network, better known as B.O.R.N, was designed to take advantage of this influx of data and help improve patient care relating to birthing. With me today is Mari Tattlebaum and Dr. Mark Walker, high-risk obstetrician and senior research scientist from the B.O.R.N team. Welcome, and thank you for taking the time to speak with us today. Can you share with us the key challenge B.O.R.N is looking to address?
Absolutely. So there are a number of information silos that happen through pregnancy and birth. Women see a number of providers, both out in the community and also in hospital, and gaining access to that information can be problematic. By integrating 109 hospitals, 6 laboratories, midwifery practice groups, and primary care providers, allows us to bring together a huge amount of information to ensure the highest quality care is being provided.
How does the B.O.R.N solution address this problem?
It really did come down to linking existing information. There was lots of information in the system already being collected in hospitals, in doctors' practices, in labs. And only by pulling that information together, integrating it, using innovative tools, could we come up with a holistic system. And it really is a case of the whole being more than the sum of its parts. There's a really good example of this. Newborn screening in Ontario is done on every baby in hospital after birth. The B.O.R.N system captures that information as well as labor and birth information, the actual births themselves. By cross-referencing that information, we can actually identify babies that may have been missed and offer them the screen after the fact.
What were some of the challenges in developing this solution?
So integration is really key in a project like this. Bringing together 5 existing data sources with 5 existing communities of users is no easy task. Dapasoft, as an integration expert, brought the expertise we needed to align that data. So an example would be the fact that every system has its own definition for birth weight. Maybe some are metric, maybe some are the old-fashioned imperial, to different levels of detail. And only using a partner like Dapasoft were we able to work through the over 600 data elements to produce a high-quality, fully integrated system.
How will this solution help care for mothers and babies?
By bringing together all of the information around pregnancy and childbirth, we start to build a picture of what care looks like in Ontario. Linking prenatal screening, labor and birth, NICU experiences, and the first few weeks of life ensures that every mother and every child is receiving the best possible care. If that's not happening, we're able to identify those situations where improvements need to be made.
How would you see this benefiting the broader healthcare system?
So first of all, at the system level, for every hospital in the province, there's 110 hospitals that provide maternity care. We're able to let them know about best practices and help them in their quality agendas to achieve these. We've done this through the development of a dashboard that lets them know where they are relative to other hospitals and ideal benchmarks with such things as cesarean sections before 39 weeks, episiotomy rates, and missed screens on newborn screening. In terms of health policy, this has been a tremendous tool to be able to evaluate the impact of policy on population health. For example, we recently did a project that looked at a screening test called fetal fibronectin that identifies women who are in true preterm labor and its impact on patients, its impact on providers, and the cost effectiveness. And it was shown to be a very effective policy that saved approximately $5 million a year for the healthcare system. And in terms of research, this really is a system that is one of a kind in the world. The power that we have in terms of sample size and analysis is quite unique. For example, recently we just completed a study that was published in the American Journal of Public Health that looked at the effect of vaccination of H1N1 during pregnancy. And this demonstrated that not only was vaccination safe, but there also was potential benefit in reducing stillbirths, small babies, and very preterm births.
Can you share with our audience some lessons learned?
The first lesson we learned was the value of leveraging existing work. We were very fortunate not to have to start from scratch, but in fact work with our 5 founding community partners to build this brand new system through integration by getting them all involved from the beginning, bringing their clinical expertise, their technical expertise. We were already halfway down the road at the very beginning. Integration was critical. Spending the time to figure out the best possible way to get everybody to fit together in the most efficient way possible saved us a lot of time. And finally, the most important thing we learned was to make sure there was value for everyone involved in the system. Making sure that as we ask for people's time, as we ask for people's data, that there's something in it for them. By providing them innovative tools and high-quality information, they understand why they're investing the time in the build to realize the benefits on the other side.
Thank you. It's wonderful to see how you're leveraging these sources of data to improve maternal-child outcomes. I'm sure there's an opportunity for other health regions to learn what you have done through providing better patient care for mothers and children.
Thank you.
Thanks.
I would like to thank you for your time today and sharing your story on the B.O.R.N initiative. Thank you.